A very good afternoon to all our viewers today. I'm Dr. Anushka from Global Hospital Parade, and we have with us today Dr. Mehraj Shinde.
Hello.
A very warm welcome, sir. Let me give a brief introduction about Dr. Mehraj. Dr. Mehraj is the Director Clinical Gastroenterology at Global Hospitals Parade. He has been practicing since 2012 and has a rich academic background. He has more than 30,000 endoscopic procedures to his credit. His special interests include therapeutic endoscopies, EUS, hepatology, clinical research, cholangioscopy, endoscopic ultrasound. So a very warm welcome, sir, to our session today.
Thank you.
So our topic for today is colon cancer screening. So let's hear from sir. Sir, to begin with, let's discuss about what exactly is colon cancer.
Colon cancer means the lining of the large intestine or the colon or the rectum is normally a very smooth lining. In certain situations, there develops abnormal cell growth or abnormal growth from the smooth lining, and these grow at a very abnormal or exponential rate and develop into what we call as a cancer or a neoplasia. In initial days, it can restrict itself to the colon. However, with time, it can spread outside the colon and to other organs like the liver, bone, and the abdominal cavities also.
Okay. So how does one understand that they have colon cancer? What symptoms should we look out for?
Well, colon cancer in the very early stages is asymptomatic, does not generally have much symptoms. This is also the time where it can be detected early and treated very well. However, many patients come with certain symptoms of colon cancer, commonest of which are passing blood in the stools, or they develop a sudden change in their bowel movements, which can either be less movements or constipation, or they can develop more bowel activity, that is diarrhea. Certain individuals also complain of change in the caliber of the stools, that they suddenly notice that their stools are very narrow and they have difficulty in passing the stools. Many patients also complain of pain in the abdomen while passing stools or otherwise. In advanced cases, they can complain of fatigability, weight loss. Many of these patients complain or come to the doctor saying that we are feeling weak and they found that their hemoglobin is low. These are all the symptoms that patients can present with when they have colon cancers.
Okay. So how common is it? What causes it?
Well, there is no exact cause known for colon cancers, but there are certain conditions which can predispose the individual to have colon cancer. Foremost of that is age. So anyone in the fifth decade or above is at risk of developing colon cancers. Certain lifestyle habits like sedentary lifestyle, obesity, smoking, eating more processed meat, processed foods. These are our risk factors for developing colon cancers. If you are suffering from any conditions related to the intestine, like inflammatory bowel disease, what's called ulcerative colitis, then you are predisposed to developing colon cancer. If you have a family member who is suffering from colon cancer or has had colon cancer, then that individual is at a higher risk of developing colon cancers. Certain inherited conditions, though rare, also predispose a patient to develop colon cancers.
Okay. What exactly are we talking about when we are saying that the predisposing conditions? That,
Yeah, so one, as I said, is the family history. Second is your lifestyle changes. Third, if you are obese, again I'm stating the fact. Then, if your diet is less of fiber
Okay.
and more of red meat or processed foods, then again you are at risk of developing colon cancers. If you're a heavy smoker, you're at risk of colon cancers. If you have a family history of certain related cancers, like cancers of the pancreas or in females, cancers of the reproductive organs, then also you are at risk of developing colon cancer.
Okay. So we already mentioned that it is more common after the age of 50. Is it also gender specific?
No, you can get it both in males and females, though it is slightly more common in males than in females. But there is no very obvious gender specificity that only males or only females. It can happen in at any gender.
Okay. So coming to our topic today, as our topic says colon cancer screening. So what is the exact idea of colon cancer screening?
Yeah. See, colon cancer screening means procedures or techniques or investigations through which we detect either colon cancer in a very early stage, or we detect certain pre-cancerous lesions in the colon. Most of the colon cancers normally arise from a precancerous lesion. That means there is excessive growth in the colon which is not yet turned malignant or cancerous. And over a period of few months or years, it will turn into cancer. So the idea of colon cancer screening is to detect individuals in that stage or in a very early stage, so that with minimum treatment, they can be completely cured of. Either we detect them in the precancerous stage. Those precancerous lesions are called as polyps, or in a very early stage, so that you can treat this patient completely with minimum investigations. Yeah, like only an endoscopic procedure and they are absolutely cured.
Okay. So as we talked about colon cancer, how is it diagnosed? Which tests do we do?
Yeah, actually there are many tests, but the test which is the most commonly done and the test which is detects cancer most surety is what we call as a colonoscopy. Colonoscopy in simple term means an actual visualization of the entire lining of the large intestine, right from the anal verge till up to the first part of the large intestine. It's around 80 to 100 centimeters of an area, and it is done through endoscope. There is a flexible tube which has a camera at the end, and this procedure is called as a colonoscopy. Everyone is aware of the term endoscopy, which is commonly used for a similar test done for the stomach and the esophagus. So colonoscopy is a test. Sometimes early evidence of colon cancer can also happen through certain stool tests. So if you do a stool test and you find traces of blood in the stools, then also you can detect colon cancers. Sometimes CT scan, as we are all aware of CT scan, can detect certain swellings in the colon. Though we cannot very surely say it is colon cancers, but they can also help us to do certain investigations to detect colon cancers.
Okay. So when should one opt for a colon cancer screening? At what age and how frequently?
Well, unfortunately, in our country, there are no guidelines. But from what we are seeing in the community and the guidelines which are available in the Western countries, colon, anybody above the age of 45 should undergo screening for colon cancers, because this is the age where the polyps start developing, and after the age of in the late 50s or 60s where we are seeing patients with cancer. So if the cancer screening is started at the age of 45, we will be able to detect these precancerous lesions, and we'll be able to treat or actually reduce the incidence of a full-blown cancer in our population. So I would recommend everybody above the age of 45, everybody who has a family history of colon cancer to do it at the age of 40, anybody who is suffering from chronic large intestine diseases like ulcerative colitis or Crohn's disease should undergo regular screening after 10 years of the disease diagnosis. Anybody who complains with history of bloody stools should also undergo screening for a colon cancer.
Okay. And how frequently should the screening be done?
Well, that will depend upon first your first endoscopy, colonoscopy finding, and also whether you are just a healthy individual doing it, or whether you have a family history and you are doing it. So the frequency would vary anywhere from once every 2 years to once every 5 years or once every 10 years, depending upon what age you are doing it and whether you have a family history or you have a predisposing lesion like a polyp or any other conditions.
Are there any stages of colon cancer?
Yes, like all cancers have early, intermediate, late, or stage 1 to stage 4. Colon cancer also has a similar stage. The basis is same. I mean, if the cancer is only localized to these, in broad terms, if it is only localized to the large intestine, it is stage 1. If it is localized to what we call as the lymph nodes, these are glands which get swollen up if we have any infection or a local cancer, then it is generally considered as stage 2. If it spreads to the surrounding organs, like from the colon, it goes to other abdominal cavities, we would call it stage 3. And if it spreads to distant organs, like from the colon, it comes to the liver, or from the colon, it goes to the bone, then we would consider this as stage 4 colon cancer. These are broad terms. Of course, there are certain other nitty-gritties in this, but broadly, this is how we would stage a colon cancer.
So with all the stages, again the question arises: can it be cured?
Yes, there is treatment available for all stages of colon cancer. Obviously, if it is detected in the precancerous or earlier stage 1, then you can even think of a complete cure from colon cancer. As the stage worsens, then you are looking at just partial cure and prolonging the longevity of the patient. And in advanced stage, well, then things become a little difficult. There are many drugs, newer drugs, and treatment modalities available. But as the stage advances, then complete cure becomes a little difficult for the patient. Also, it depends on whether the patient is a young 45-year-old or an elderly 75-year-old with other comorbidities. The treatment success takes many things into consideration.
Right. This again highlights the importance of screening, so that
Yes.
if an early catch is there, we can treat it
Yes,
completely.
and we are seeing colon cancer on the rise. We are seeing colon cancers at more frequently. We are seeing colon cancers in younger individuals. We are seeing colon cancers where just seemingly healthy individuals just did a routine blood check and a routine health checkup and found that the stool had some traces of blood and it was found to have a fairly advanced colon cancer. So we would recommend colon cancer screening, though a national-wide recommendation would still take some time. But we would recommend colon cancer screening at least to everybody above the age of 45 or 50 years. At least one colonoscopy to have a baseline screening is, I think, a good health measure to avoid a seemingly difficult condition later on.
Right. So again, coming to prevention. So as we all know, prevention will always be better than cure. How can we prevent, or is it even preventable?
Yes. See, we know the risk factors, so avoid the risk factors.
Okay.
One, maintain a healthy lifestyle. As I said, sedentary lifestyle and obesity is a risk factor. So obviously, if you are healthy, exercising at least 20 to 30 minutes for most days of a week, avoid high risk behaviors like smoking, maintain a healthy diet, include a lot of fluid, a lot of fiber, vegetables in your diet, lean meat, avoid red meat or processed meat. Smoking, as I said, is one risk factor. And if you have any family history or a known history, then don't ignore it, even if it is a past. Like you might say, "Oh, I was diagnosed with this condition 10 years back," or "My family had a colon cancer, but I am healthy." Look at these things and do a proper screening. Screening is a modality for prevention, not for cure. So if we are doing these healthy things and look at screening on a very serious note, we can actually prevent colon cancer from rising in our country.
Definitely. So as we are coming to the end of our session today, would you like to give a message to our viewers today regarding this topic?
Yeah, what I would like to give a message is that don't ignore your gut health. Gut health is very important for the general well-being. So maintain a healthy lifestyle, take care of your diet, make sure you don't have a sedentary lifestyle, and don't ignore any symptoms. If you notice any symptoms related to change in your gut health or bowel habits, or occasionally blood in stools. The commonest mistake people do is that small amount of blood in stool will be attributed to mild conditions like piles or fissure. Please get it evaluated, show to a doctor, and get yourself checked. This is what I would like to say to our audience.
Definitely, sir. I think these small symptoms are generally ignored by
Ignored.
people, and now that we know the importance of these symptoms being tested, I think it will really be helpful to everybody. So, thank you so much, sir, for today's session. It was
Thank you.
really informative. Thank you to all our viewers today to be here with us today. Thank you so much.
Thank you.